Welcome back, y'all, to season 5 of In the Wild. I am super excited to be back with y'all, and we have a very special guest. So, now that we're back on campus, partying and getting your social life together is a hot topic, or wild topic, as we like to say. And we have a very special guest to kind of help us, I guess, be a little bit more socially responsible. He is an associate professor for the Medical College of Georgia, and he is the director of the Addiction Medicine Fellowship Program. So give a warm Jagger welcome to Dr. Marshall Better.
Thank you very much. Great to be here.
Yes, thank you for being here. I know it's a busy time of year, so we really appreciate your time. Diving right in, how did you get into this specialty?
Well, my primary specialty was anesthesiology, but very quickly I became interested in pain, and I became double boarded in pain medicine. And then I realized doing pain medicine that if you don't know about addiction, you got problems. And it's difficult in dealing with people who are on controlled substances. So it came really out of, the pain clinic and then evolved into addiction in general. And here I am, I'm still doing pain, but also addiction for Augusta University at MCG.
Can you explain a little bit why partying and substance use among college students can be so risky and have significant dangers to their health?
Well, unfortunately, probably 30% of students have signs of alcohol abuse.
Oh, wow.
80% have abused. And mainly, as you know, in colleges, it's binge drinking. And so they'll study, they'll be good during the week. Weekend comes, go crazy, and they all drink. And what is binge drinking? Well, if you look at what a normal people would drink, whoever they are, for a woman it's about 3 drinks a day maximum, a man about 4 drinks a day, but usually not over 12 to 14, again 14 for the man, 12 for the woman, a week. That would be, if you were approaching those levels, it would be risky behavior. But in universities, they come, some are right out of high school, and they don't have parental control or even access, and they have new friends and they want to fit in, and everyone's going to the bar, so they go to the bar, and they haven't really drank much. Now, if they're of age, and things can get out of control. If there's lax ID checks going on, they're more likely to drink. And of course, what happens when you drink too much? You lose control. And if you lose control, you can do risky things. You can do things that put you in danger, such as you may get pregnant, such as you may drive drunk. What happens? You get a DUI. That's not going to be very good for your future, especially if you want to go into law or medicine and you get a DUI or you injure someone or kill someone. So we have to, I think, have a buddy system, is what I think. So when you're in the Navy, as I was, you always had a battle buddy, right? And that's, if you're going out, you have a friend, someone you trust that can make sure that you're safe and get home, and that your friend is safe and gets home. And you look after each other so you don't get out of control. We also know that people can put things in your drink to take advantage of you. And you don't know about that. And so that's a danger. But again, you have your friend with you, and they can intervene for you. So there's a lot of issues. And it's not just going out and partying, but it's also studying for exams. And maybe, oh, my friend's got some Adderall because they're losing weight and they've got a prescription. And now you're taking Adderall to stay awake. And that can lead to a lot of problems as well. It can lead to polysubstance use as well. So it's not just the drinking. Drinking is the number one problem. But right behind it is cannabis. And then behind that is the amphetamine type drugs that people use for studying, and often come from diet pills that they get per prescription.
Yeah, I remember my freshman year, someone actually offered me Adderall, and I was like, I don't even know what this is. But they were like, oh, it'll help you study. Like, it'll help you study better if you need to focus. And I was like, okay.
Yeah.
Why are we trying to take medicine to help study? But that was a very, I guess, and can still be a very popular.
It's very popular, and it can be deadly too. You can get arrhythmias from it, meaning your heart can, skip beats. And alcohol and excessive alcohol can do that as well. You combine them, not a very good thing at all. The other thing I like to warn folks about, kids about, young adults about, is cannabis. It's not what grandma smoked. It used to be 4 or 5%. Now it's 25%.
Oh,
And
wow.
if you get any of the like the butters or the shatters or the edible stuff, it can go up to 85%. And that's why in Colorado, when they looked at the year after, actually they did 5 years after of legalization of cannabis in Colorado, the rate of admission to the emergency room for psychotic episodes was through the roof.
Oh, wow.
Was 5 times actually, and that's because the potency can give you anxiety and even a psychotic kind of effect. So it's not an innocuous drug at all, and you don't know. We have no idea of what the potency is or what it is, or is it laced with
Oh,
fentanyl
yeah.
or cocaine. So there's everything out there. They're here in a wonderful school for a wonderful future. Let's get there. Let's be smart about it.
What are some of the other like effects to someone's mental health from excessive alcohol or drug abuse?
Well, I mean, there can be it depends on how excessive, of course. Uh, if you do this not too frequently, it may not affect you that much, but it can affect your memory. Certainly, memory goes along with studying, goes along with exams, and so your grades will deteriorate and you may wash out because things don't work out too well. Alcohol can affect your liver, of course, as well as your brain, and in fact, many other body systems. People who drink a lot tend to get high blood pressure. They can get atrial fibrillation even. It can lead to infections because your resistance goes down, your immunity goes down. Not to mention just plain old getting drunk, you're going to fall down and break something,
Mm.
and that is very common too. So it's a lot of issues with any substance that alters your normal sort of sensorium.
What are some, I guess, signs that we could look for to kind of for to help, I guess, identify or indicate an addiction problem?
Well, and what you're going to see is your friend, let's say, isn't coming to class or is coming late all the time or doesn't get their assignments done or, that type of thing. You're going to notice a change in behavior. And if you've known them before or if you get to know them and things change. So you got to look for that type of thing. At work, we'd see a lot of absenteeism or a lot of sick call, things of that nature. Oh, I'm sick, I can't come in today. Or for drug use, they're leaving all the time in between to go do whatever drug they're using. So all of a sudden, where's John? He's not here. He's always out in the parking lot. And you'll see this. I got to get something in my car. He's always got to get something out of his car. Those types of things you want to take a look at. Also, if someone's coming in, their eyes are always injected, maybe, or they're just not looking good. They start forgetting about their the way they look. And they don't dress appropriately. They don't wash as much because they're just absorbed with taking medications. You can see all these behaviors beginning. They might even start exhibiting some bizarre behavior if it's depends on the drug they're taking.
So, what would you recommend to, I guess, different colleges, universities, faculty, and staff to kind of be mindful and just help prevent these issues from happening?
Well, I guess doing things like we're doing today is a great start. Having flyers or whatever go out from the health clinics, student health, employee health, so that they know that there's access. Now we've got a great website, and they do put these types of information out there. And students should know that if they look on the websites, they're going to find this type of information. They may not need it. I hope they don't need it, but they may need it for a friend. And so as we encourage, and I certainly encourage the webcasts and the podcasts and, whatever things you can do to spread the word that we're aware of the issues, we have help for them, and we want to prevent them from getting to that stage altogether.
So switching gears a little bit, As a professor, how do you go about teaching and training students on this stuff?
Well, we teach them and train them as we do in any chronic disease, which is what addiction really is. Um, there's all stages, and sometimes we catch someone very early on, which is we would rather do that, and maybe they're just at risk at this point. And so, you always have to, when you interact with the patient, ask these questions, and we teach them not to be afraid to ask these questions because that will save their lives potentially or their careers. And so we teach by training on people who unfortunately have this problem. Just as you would do rounds on cardiology patients, we could do rounds on patients who are in for overdose or in for behavioral issues because of chemical dependency, substance use disorder, and in the fellowship program, we have 4 different sites that we go to. So there's one site at Augusta University, the main hospital, and on the psychiatry. We're part of the Department of Psychiatry, but you don't have to be a psychiatry resident to go into addiction medicine. To go into addiction medicine, you just need to have finished a residency in one of the approved residencies, okay, ACGME approved residencies, and then they do that extra year in addiction medicine. So one rotation is in the consultation service, so people coming in through the emergency room, people on the floor, and so you're going around and you're seeing all these folks. That's one. The other one is at Hope House, which is a wonderful place where women and children go and really to maintain sobriety, achieve sobriety, and either keep their children or, because of court order, avoid prison time. And then there's the VA where I work as well, and we have 2 rotations there, one more mental health and the other one in for pain, because pain, there's an intersection between pain and addiction. They have to know that. Very important these days with all the prescription medications that we have. So by going to these various locations, seeing different populations, the women's population higher in amphetamine use, the VA probably higher in alcohol use, and then more acute people off the street, through the ER, probably more heroin and things of that nature. They get to see the whole ball of wax, everything that's being used and actually coming in through the street, and that's how we train them, real life.
As a physician, what is that experience like for you to kind of help someone through recovery and maintain their sobriety?
Well, there are many ways to save a life. And when I was way back in the day doing anesthesia and you intubate someone and you save them from, they weren't breathing and then an operation goes on, that's one way. But we do the same thing, but we don't intubate them. We talk to them, we get to know them, and we help them. We help them to engage in the process of sobriety, to understand there is hope and help, and there's now medication-assisted treatment. In the past, they had none of this. We have medications such as Suboxone, or naltrexone, or acamprosate, or disulfiram, many medications that can help decrease craving and also make it safer as they continue their journey in sobriety. So it's become a very scientific process, as well as using, the behavioral aspects as well, and is so gratifying.
You have some visual aids here.
Oh yes.
I would love for you to kind of walk me through what you brought.
Well, first we'll look at you, and this might be your brain on drugs in the 1970s or 80s. And we
Okay.
used to use this slide. I had this slide in all my slide decks, not PowerPoint. We didn't have PowerPoint. We had slides. And this is very popular. This was a way to try and get all these students, get, sort of shock them a bit. This is horrible. But we've become more sophisticated. And we actually know that this is your brain on drugs. This happens to be pictures of radioactive cocaine showing binding sites in the brain.
Oh, wow.
But we can do functional MRIs, we can do PET scans, we can see changes in the brain from someone who has a normal brain to someone who has an amphetamine addicted brain, and then even when they recover, and there's recovery of brain tissue. You can lose gray matter, you can get changes in receptor fields. So we see and it is a disease, we can look at it just as we look at heart function. When they do radionuclide scans for cardiac, they can see how the heart functions. We can also see, we don't use this on a regular basis, but we now have the understanding so much more than we ever did to understand this is a brain disease, it's a chronic disease, and if someone has a true addiction, they have it, and they have to deal with it for life. And so just though as a patient with bad asthma or COPD will be on an inhaler for life, someone with an addiction may be on Suboxone for life. The recidivism rate is very much similar to someone, let's say, a diabetic who doesn't take their insulin regularly, or someone who gets a bad bout of, bronchospasm, and then maybe they miss their medications. Pretty much similar like any other chronic disease. So we deal with it such as that. There should be no more stigmata if you're a substance use disorder patient than if you're a chronic heart failure patient, really. But society, of course, has other problems.
Speaking of other problems, when we come back, we'll talk a little bit more about some other things that are affecting the
Sure.
state of Georgia.
My pleasure.
We are soulful, legendary in our own right, and undeniably funky, home to an experience like no other, and nestled on the warm banks of the mighty Savannah River. Augusta is calling you. Welcome to a place of charm and opportunity, and a customized experience. Here we build, think, grow, and forge. Augusta University, an experience like no other.
Welcome back, y'all. Here with me is Dr. Marshall Better, and we are kind of continuing our conversation about addictive medicine. And one thing that has been affecting not only, I guess, our area, but throughout the state of Georgia is the opioid epidemic. Could you provide a little overview about this crisis in Georgia and how it is in fact impacting our communities?
Well, of course, this is a national problem, not just a local problem, but it sure does impact our community. And we're at a more at-risk community, less providers, certainly less addiction providers, a little more poverty, economic issues. And so the whole 18 counties of the CSRA is a sort of under developed area for the addiction treatment. And so that's why we actually were able to obtain a HRSA grant 3 years ago, which enabled us to stand up this addiction medicine fellowship program. And we're doing our bit by training 4 fellows, 4 doctors in addiction medicine every year. And many of them stay here. We hired our chief fellow from last year, and she works with me full time, Dr. Jasmine Shell, and she works full time at the VA doing addiction medicine. And so that's been very, very helpful. But the problem is that we're now at over 110,000 deaths a year and 2,000 deaths a year in the state of Georgia. And so it's a real problem. And those are opioid deaths, never mind alcohol deaths and other deaths, and never mind the motor vehicle accidents and the trauma, falling downstairs, falling off buildings, and the suicides. It's a litany of problems, and it's a huge social problem. It's a huge cost problem, the medical stressors on the system. So it's a real problem, and it comes from many factors. It can come from people getting prescription medications, but that's not the big problem now. The majority of the deaths come from synthetic drugs, mainly fentanyl. And what happens? If you go to the street and say, I want a pain pill, or someone says, hey, I've got some pain pills here, maybe you want to take one, or let's go to a party here, take this pain pill. Every pain pill on the street, unless you take it from Granny, is fentanyl. It's from South America, and they're mushed together and put in very crude pill presses, and no quality control. How much fentanyl went to the pill A, and how much went into pill B? No way of knowing.
Oh, wow.
You may get the pill that has all the fentanyl, and you're dead. You may get the pill that has a little bit of fentanyl, and you think, oh, this is pretty good. I might try it again. So the danger is that even if you are taking, let's say, illicit drugs, you still don't know what you're getting. And that is what's killing you. They're lacing cannabis and other medications with it too to make it more potent and more addictive. If you're more addictive and you like it, you're going to go back and buy this medication from him or her, whoever. So it's a major problem. And of course, the death toll speaks for itself. But the saddest thing, or where there's a good student doing well, lives at home, he goes to a party and someone gives him this pill, and all of a sudden they're dead. Or the other thing, of course, is you take the pill, but you're drinking as well, two depressants, and then boom. And this is what happened to all the movie stars, and they drop because they have some pills on board, they drink, and you don't know when it's going to happen. You just stop breathing because it suppresses breathing. It suppresses a lot of function. And that's why everyone's getting Narcan, nasal Narcan. Narcan can reverse the effects of opioids. But the opioids are getting so strong that we used to have to use one, but now you can use up to 8. So they even
Oh,
made a
wow.
stronger Narcan, double the strength, because of these synthetic fentanyls we're seeing. And it's even getting worse.
That's terrifying.
Yes, it is terrifying, and it's real.
So I guess just diving deeper, how does it more so intersect with college campuses and college students?
They're going to see it mainly in the partying. And, and I'll tell you some silly things that happen, such as they may have heard of a thing called a farming party. We think farming, as in pharma, PHAR.
Oh,
So everyone brings a bottle of pills from their moms or aunties or their medicine cabinet, and they empty it into a bowl. They mix it up, and everyone who comes in takes a handful. Well, that's Russian roulette. But it happens. I mean, this does happen. I didn't make this up. And so that's bad. So if you go to one of those parties, don't take the candies out of the bowl. That's number one. Number two, you know, it's a weekend. It's stressful. You're studying hard. So I can understand that kids want to relax. Anyone wants to relax, but everything in moderation. You should drink in moderation, but drugs shouldn't really play a role because you do not know what you're getting. There is no quality control. It's just out the window. And we're not even talking about getting to injectable drugs, where, of course, you get abscesses and endocarditis and strokes and speed. You can get amphetamines and cocaine, absolutely, strokes and arrhythmias. And the arrhythmias can stop your heart, and boom. So we're talking about serious side effects from these medications. And so they have to be wary when they go to the big parties because someone wants to sell you something. That's how they make money, to often feed their own habit. So just, be careful. Be careful out there, as they say in that TV show.
So I guess going off of that, what would you recommend for students who are eager to just, experience their social life or start this new chapter?
Well, I think they're very lucky here in Augusta. We have a wonderful performing arts hall. They can really see a variety of really interesting things. We have a great music scene in Augusta, and there's bands that come in all the time. We have a great art scene. There's little galleries popping up, even on Broad Street. Great musicals. We have two very fine performing arts, the Miller Theater downtown and the Imperial, and they're renovating James Brown
Oh, yeah?
Arena. So, there's a lot of other great things to do in Augusta, not to mention the natural beauty and going out. But, I mean, if you want activity and nightlife, it's here. And that's what I grew up with, great music, and sure, you'd go and have a few drinks, but again, you go with your friends, you look out for each other, and there should be no problem with that.
What role does stigma and stereotypes kind of play into maybe hindering the access of someone wanting to get treatment for being addicted to
Well,
something?
I think there's still a misunderstanding of addiction and a fear of addiction. But, for the first, this is the third year now, they have me teaching 2 classes to their first year medical students within the first month. That never happened. I never had one lecture on addiction when I went to university. But here, they understand you got to get it early. Let them help them understand about those things. So everyone gets, at least in medical school, they're getting these lectures. So that's a wonderful thing.
And I guess for those who maybe are, maybe aren't struggling with addiction or just having or overusing those drugs, how do they, or what would be the best way for them to seek help? Would you recommend?
Well, again, I think there's some great information and helplines and numbers on the websites. If you were to go and Google it, you'd find a number of sites in town. But there's student health is always the best place to go. You can always ask one of your professors or instructors that you feel that you can approach. Probably friends know. They're not hiding this anymore. There are lots of resources. You just have to, either you or your friend or your family have to reach out. I also encourage them to talk to their families and don't isolate from them. They want only the best. And I think when they understand and they talk to a medical professional, it's not that you're bad, it's that this thing may have occurred. Look, it could be just circumstantial. Drug use can, because it's available, you started. Does that mean you have some psychiatric problem? No. It could be a social pressure thing. We do know that addiction has a very strong component of genetics behind it. About 50% of people have a genetic issue with it. Ones who are, suffering from substance use disorder because they had a first-degree relative, father, mother, maybe grandmother, grandfather, who had let's say, an alcohol problem or whatever. And so that's a component, but it doesn't just happen. You have to have access. Well, they're away from parental interference. So that's, so access available. The bars are open, or they have fake ID, or they have friends who get them drink. So it's all, and then maybe they're stressed and there's a reason for it, so they go looking for something. So there's many things that sort of combine to get someone on the wrong track, but there are ways to ask for help. A lot of hotlines, and they'll see on the JAG, I'm sure, tons of options, right?
Yeah. Another question that I had was, how does, I guess, because we see that there are users of all ages, right? So how does one, I guess, get started or have an interest to try an illicit drug when they hear about the dangers, they know that they probably shouldn't be doing it? How does
Okay.
that process start?
Well, there are certain at-risk people. And so let's say you have an upbringing where maybe you don't have a father in the family, or maybe your mother didn't nurture you, and that's one of the biggest things we have. So some people are unfortunately destined to have some issues because of psychological or even psychiatric issues. And so they may be more predisposed to say, I'm depressed, have a horrible life, and screw my parents, and I'm going to, cannabis, I'm going to try some. And then from cannabis, the guy selling you cannabis has some pills. Next thing you know, he's giving you some pills. And after that, it can get even worse. And that's often a common thing that we see. But mainly it's peer pressure. Oh, you go ahead, it's just a little acid. You can try it. We're all doing it tonight. You're going to be the only one not. Ooh, they're not going to like me. I'm going to be not cool. Don't give in to that pressure, because it can really hurt you.
And that does make sense. Do you have any other thoughts on how, I guess, students can be more responsible or kind of just stay away from things that they may know
Well,
are harmful?
I think they should respect themselves more and understand why they're here. Just think about it. Why am I doing this journey through university and beyond to waste it potentially my life and even end my life by doing an illicit drug? I think if people just think about it before doing it, it's like, don't send that email till you read it again.
Yeah.
Same thing. Don't do that drug till you think about it again. Where did this come from? Maybe I shouldn't take this. Psst, throw it away. And I think they may not understand we really care about these people, called students who are at our university. They may not think so, but it's true. And it's painful for us to lose someone. Just we feel we've failed. So, and they should also think about their parents and their loved ones and what would they do if they lost them? I mean, that would be, again, think twice. That's what I'd say.
I appreciate your insights. And before we let you go, when we come back, we have a fun game for you.
Can't wait.
All right, we're back with Dr. Marshall Better. And now we're going to put you in the hot seat just a little bit with a little myth busting. Fun game called Fact or Fiction you have in your hand here, a little handheld. So I'm going to read you some true or false questions, and I want you to give us your take on it.
First, I should inform our listeners and our viewers that I am doing this under protest.
First up, fact or fiction, it's safe to mix alcohol with energy drinks because the stimulants in energy drinks counteract the depressant effects of alcohol.
That's a question on the exam.
Oh, wow.
Yeah, you got to be very careful with that because, again, there can be stimulants in there that could even give you arrhythmias as well, and it's also a fiction because you may potentially drink more because you don't feel as drunk.
Oh, yeah.
And that's a danger.
Next up, binge drinking is only harmful if it happens regularly. Occasional episodes of heavy drinking are relatively harmless.
Fiction, because you could kill yourself, that big binge.
Whew, that's scary. Next up, drinking coffee or taking a cold shower can sober someone up quickly and make them fit to drive after consuming a lot of alcohol.
I want 2 signs for that one.
Double fiction?
You basically metabolize your alcohol. If you want a good rule of thumb, 1 normal drink, that's 1 and whatever, half ounces, per hour. So if you had 3 drinks, you better not drive for at least 4 hours.
1 drink, 4 hours.
Well, no. If you had 3 drinks, your body metabolizes 1 drink, 1 normal-sized drink, per hour. So that's 1 beer or 1 shot per hour. So that's a general rule. It takes an hour to metabolize that.
Using prescription medicine that isn't prescribed to you is safe as long as you know the recommended dosage.
Fiction. Never take anyone else's medication because you don't know the side effects and if there could be any interaction with you may be on.
So far, all fiction. A lot of
Yes.
insights.
Yeah.
It's okay to leave someone who appears highly intoxicated alone to sleep, even if they're not showing signs of distress.
That's a fiction because they may vomit and have a respiratory arrest, whereas if you were there to watch and put them on their side, they would be safe and wouldn't have any harmful effect.
Next up, the effect of alcohol and drugs can vary greatly depending on body weight, so smaller individuals can safely consume larger amounts.
That's backwards. No, and especially women, the gender as well as things. Women do not metabolize alcohol as fast as men, and different distribution of volume also. So that's wrong.
Eating a heavy meal before drinking alcohol can prevent intoxication and reduce the risk of alcohol poisoning.
Well, I hate to tell you again, it will delay the onset, but you will eventually get drunk and have all the issues that you have. But it does delay it.
Okay, so you'll feel it eventually.
Yes.
The use of illicit drugs at parties is unlikely to result in addiction or long-term health consequences if done only recreationally.
Well, I hate to hold this. My favorite color is blue, but I'm doing green. You don't know what you're taking. Even the first time, if you get the wrong fentanyl pill, unfortunately, that could result in death. You could take cocaine, and you get an arrhythmia, and you collapse on the floor, and there's no one to resuscitate you. So, no, not true.
Alcohol is a bad way to choose to stay warm in cold weather because it increases your body temperature.
Correct. You're going to dissipate. Yes. And so in the cold, if you're like up in Alaska and you say, I'm going to take some alcohol, the exact worst thing to do.
Oh, wow.
Vasodilation, you lose heat.
Okay, so technically that one was, I guess,
It's a
fact?
bad way. You said a bad way.
Yeah, alcohol is a bad
Oh, yeah.
way.
Bad way. Sorry about that, folks.
Okay.
Fact. Bad way.
Okay, so we
Bad
got
way.
one.
One fact.
One fact so far.
It is a bad way. Yes, bad way.
Uh, that's all of them. I was skipping around trying to see if I could throw you off a little bit, but yeah,
Well, I guess I've trained my fellows right.
you passed. They
Thank you.
passed.
We all passed, and they did.
And so thank you so much, Dr. Vetter, for being here. I'm sure everyone, including myself, listening, were super educated today.
Wonderful. Thanks for having me. I appreciate it very much.